Hi, this is Dr. Beltry from Beltry Bariatrics, and I'm going to briefly be talking about the gastric bypass. This is the gastric bypass. The gastric bypass is the second most commonly done weight loss procedure worldwide, right? First is the sleeve, and then a close second is the gastric bypass. The bypass is one of the first procedures ever invented for weight loss, right? We did the first gastric bypasses in the 1960s. Of course, things have changed, and we have modified the procedure to the one that we do today. When we started doing gastric bypass, it was done open, for example. Now it's done laparoscopically or robotically. So this procedure can be done laparoscopically or robotically, meaning with small incisions, right? The biggest one is less than half an inch. We would try to hide in the belly button. The other one's about diameter of a pencil, 5 millimeters. So depending how you heal, you hardly see any scarring. The gastric bypass takes about an hour and a half to 2 hours, whether laparoscopically or robotically. And basically, what we are doing with the gastric bypass is, first of all, we make a small pouch, small stomach out of the main stomach, right? The main stomach, we do not remove anything with the gastric bypass. The main stomach remains there, but it's completely bypassed, right? No food. That part of the stomach doesn't see any food anymore. And then to establish continuity of the intestine, we reconnect the intestine to the small intestine here, the anastomosis. So now food goes from your pouch continues down into the small intestines. If you notice, the bypass stomach still makes gastric juices for digestion. There's bile coming here from the gallbladder and the liver. Pancreas, which is supposed to sits right here, makes pancreatic juices that help with the digestion of fats and proteins and so on. And all these juices now come down this way and mixes in with the food here that's coming from the top, and then digestions begin. This is the gastric bypass. The gastric bypass is a very potent surgery in terms of weight loss, but like I tell all my patients, this is a tool, right? I'm sure you guys heard that before. It's a tool to help you change dietary habits. Truth is, the bypass still needs to be combined with good eating habits. Any of the surgical procedures that we do for weight loss still needs to be combined with good eating habits for it to work. What the surgery offers you? Well, the surgery will make the process easier because it will give you portion control, because you have a smaller stomach, right? And then appetite control, because remember, we are bypassing the main stomach where ghrelin is made. Ghrelin is a hormone that makes you hungry. We're bypassing the main stomach where ghrelin is made. So therefore, your appetite it's well controlled as well. So the surgery works by giving you restriction, you're eating less, and controlling your appetite. However, that's only half of the story, right? There's a lot of other things that take place with these procedures. The gastric bypass is referred to as a metabolic procedure because it has metabolic components to it. There are releases of certain hormones that occurs after the gastric bypass that help you lose weight. I mentioned one already. For example, the ghrelin release is controlled, so therefore your appetite is controlling that aspect. But also because we are bypassing the upper part of the intestines, the duodenum, the pancreas here, this part of the intestine doesn't see any food. There is a more potent release of certain type of hormones like GLP-1, for example, which is a glucagon-like polypeptide, which is a protein that acts like a hormone that increases release of insulin from your pancreas and makes you sensitive to your own insulin. So therefore, type 2 diabetes, for example, begins to go away very quickly after a gastric bypass. I have patients that the diabetes type 2 begins to get control as soon as they get home from the hospital, right? And some of them, a few days later, don't have any type 2 diabetes. It completely stopped and goes into remission. And then definitely by a week or two later, that type 2 diabetes is completely gone. Sleep apnea, of course, goes away very quickly, sometimes within the first couple of weeks. High blood pressure also goes away fairly quickly. And anything that is weight related begins to go away quickly. And when I talk about going away, I'm talking about you don't need the medicines anymore, right? You stop taking type 2 diabetic medicines or insulin. You stop taking the high blood pressure medicine. You don't need the CPAP machine anymore to sleep because of your sleep apnea. So this is a true metabolic procedure that works really well. But like I said, it is a tool that when combined with good eating habits, it gives you a substantial amount of weight loss. So again, what the pros with the gastric bypass? A very potent metabolic procedure, more so than the gastric sleeve in that respect. There's more hormones, or the hormones are more released, more potent with the gastric bypass compared to the gastric sleeve. Some individuals might say there's slightly better appetite control with the gastric sleeve because the ghrelin is suppressed even more with the gastric sleeve. Of course, you have the portion control, And like I said, with adrenaline, you have the appetite control, and weight loss can be a little bit more substantial. And studies are showing slightly less weight regain with the sleeve, with the gastric bypass compared to the gastric sleeve. Well, what are the cons with the gastric bypass? Anything that we do has potential complications, right? So there are certain things that we need to watch out for with the gastric bypass. First of all, the vitamins. You have to take your multivitamins, right? You want to avoid vitamin deficiency. So vitamin deficiency can much easily occur with the gastric bypass than it can with the gastric sleeve, right? There's hardly any vitamin deficiency with the gastric sleeve, but it can definitely happen with the gastric bypass, especially iron, right? Iron is usually absorbed right here in the duodenum, this part of the intestine, the upper part of the intestines, and we're bypassing that. So some individuals can have iron problems. Some patients can have iron problems even after taking iron, right? There are patients out there that despite the fact that the multivitamins they're taking iron, it's not still sufficient enough, and they might need to have iron transfusion every once or twice a year. This is rare. We'll say maybe less than 1%, but it can happen as a result of the gastric bypass. B12 deficiency, right? In order for us to absorb B12 vitamins, it has to be coupled with a protein that is made in the stomach. Well, the main stomach is bypassed now, so it doesn't see any food. So some individuals can potentially develop B12 deficiency. However, I can tell you that if you take your vitamins, your bariatric multivitamins, your B12, your iron, you hardly have any of these issues. So taking your multivitamins to avoid anemia as a result of vitamin deficiency, iron or B12 is very important. Of course, there can be other issues with less mentioned vitamins like copper, calcium, and so on. But again, those can be avoided if you take your multivitamins. Other potential risk with the gastric bypass, I don't like to do gastric bypasses in smokers because you can develop ulcers. You can very easily develop ulcers up here where that connection is made with the small stomach and the intestines. Those are called marginal ulcers, right? And who gets ulcers? Smokers and patients that use too much NSAIDs or aspirin, ibuprofen, and leaf, things like that. So I have to be very careful. In fact, tell my patients do not take your NSAIDs, Motrin, Aleve, ibuprofen after a gastric bypass because you can potentially develop ulcers here. Those ulcers tend to heal once you stop the medicine. However, ulcers that are caused by smoking, those tend to be kind of more long-term. So smokers tend to get these really bad marginal ulcers here that won't heal until you stop smoking, and they can develop strictures and things like that, which is a narrowing of this connection here that might need to be stretched by the gastroenterologist. And I see more of those in my chronic smokers. So smokers, if you're a heavy smoker, you should have another procedure unless you're definitely going to stop smoking. So I tend not to do gastric bypass in heavy smokers anymore because I know they're going to develop issues later. Then there are other potential things like internal hernias that can occur with the gastric bypass. That happens maybe 1% or less of the time. And these hernias can lead to bowel obstructions. Normally, you see those down the line after you lost at least 100 pounds. This is not something that happens right away. Normally, we do close those potential spaces. You're bringing intestines over the colon and the stomach, so you create these spaces that were not there before. We close those so that you don't develop these internal hernias. Again, if you're going to develop internal hernias with bowel obstructions, it usually happens a year or more later after you have lost a lot of weight. A lot of that fat has melted away and exposes some of these defects. Those are some of the main points with the gastric bypass. I hope this helps you in terms of making your decision. The bypass is still a very safe procedure. How safe is it? This gastric bypass is as safe as getting a hip replacement, right? And people get hip replacement all the time and we don't hear anything about it. Statistically speaking, that's how safe a gastric bypass is. So it's very safe. If you're not going to smoke or you're not a smoker, you're going to take your multivitamins. You go to an experienced bariatric surgeon, you can get a gastric bypass and do really well with it. Right? I hope this really helps make your decision in terms of obesity surgery.